You're going to go ahead and have a seat right here. We'll get started with some questions. My name is Megan. I'm a student physical therapist assistant who's going to be working with you today, helping you out. I wanted to start with just a confirmation of your diagnosis. Did your doctor explain to you what your disc herniation was?
Not really.
So with a disc herniation, I have a picture that I can pull up to help visualize what's going on here. So the location that you have yours done at, this is the picture that I'm using. Okay. So right here in this lower region right here, these are the two spine bones that are largely associated with your injury. This disc in the middle is just there. It's like a fibrous disc that will absorb shock and help keep those bones from rubbing on each other. And so what happened was that disc there just kind of is out of place. It's not where it's supposed to be. And that's what that loud pop was whenever you were doing yard work. So I'm going to start with some simple questions just about your pain and how that's affecting you, and then we'll get into traction, explaining what it is, how it'll help you, and then getting it set up.
Okay.
So, are you in large amounts of pain today?
I mean, it was sore when I woke up, and then when I moved around a little bit, I had some sharp pain, but I'm trying not to do a whole lot.
Okay.
But
And the pain that you're feeling right now on a scale of 0 to 10, 0 being no pain, 10 being the worst, where would you rate that at?
well, when I'm just sitting still,
Mm-hmm.
it's like maybe a 5.
Okay.
And then if I go to stand up, or if I cough, sneeze, things like that, where it's like sudden movements, then
It makes it worse.
kind of just like a sharp twinge of pain, maybe a 7 or so, and then
Okay.
but pretty consistent, about a 5.
Okay, that sounds good. And so that pain, how is that affecting the things that you do every day? I understand this happened during yard work, so I imagine you're a pretty active person.
Absolutely.
So how is that everything else that you're doing? Is that still pretty normal, or is you pretty?
Well, I try and do as much as I can. I think bending over and pushing and pulling, the lawnmower, and that it just hurts too much right now.
Okay.
So,
Right.
and the doctor was like, try to rest for a couple weeks and not do too much, but I do what I can.
Yeah. And did he give you any medications to take for the pain?
Yeah, he gave me. I take a meloxicam in the morning, and so then I don't have to take ibuprofen all day or something. And then if I have the sharp shooting pain and I can't get it to go away, then I have a muscle relaxer,
Okay.
something like
That all sounds
Scalaxin or something like that. Do you want me to get the medicine?
I think we have it in your chart. It should be
Okay.
fine.
Okay.
And if we do need it for future purposes, we can get it. So, now we've got those questions out of the way, I want to, before we get into explaining traction and how it's going to help you and getting into it, I want to clear you of some things that could cause the treatment to be unsafe or ineffective for you. So they're just some questions about your personal medical history, just answer to the best of your abilities,
Okay.
and then we'll go from there.
Okay.
So the first question is if you have any spinal fusions or spinal surgeries that you're aware of. Do you have any history of rheumatoid arthritis, osteoporosis, or any other diagnosis that would cause instability of your
Not
spine?
in my back.
Okay.
Some arthritis in my ankles.
Okay, well, in your back is
No,
fine.
no.
And then do you have any hypermobility, like the bones in your spine, are they moving around any more than they're supposed to be?
Not that I know of.
Okay, and any spinal cancer or infections? And just a precaution, I don't think that's anything to be aware of right now, but do you think that you currently are or could be pregnant right now?
No, I went through menopause.
Okay, and then the last question is about spinal cord compression or spinal cord injuries, any of those?
No.
No? Okay, perfect.
Well, like back injury.
Well, the spinal cord injury that we are concerned about is the actual spinal cord itself,
No,
and the spinal cord ends long, like a couple
no, I don't have
higher.
any of
Okay.
that. I don't have any of that.
So now that we're through that, I'm also going to use this picture again to try and explain to you what traction is going to do on your spine and how
Okay.
it's going to help.
Okay.
So first off, traction is the process of pulling your spinal vertebrae apart,
Okay.
not anymore to hurt you any further than you already are, but just enough to help create a suction or vacuum-like force that will help pull that disc back into its normal spot, which will alleviate a lot of the pain and other symptoms that you're having, like the numbness and tingling in your leg.
Mhm.
That is mostly due to a nerve that is possibly pinched or irritated in that area. So it's going to cause the sensation of numbness and tingling down your back. And so with traction, it's going to help get rid of some of that pain. It's going to help those numbness and tingling sensations move back up your body and centralize a little bit more. So with this picture, so what traction is going to do, we're going to do a pelvic traction. So we're going to be pulling from like your hip end and not your neck end. There's two different ways to do it, but for this one, so it's going to pull apart these two vertebrae and help that disc get sucked back into place where it needs to be, basically.
So it's just like a one-time thing?
So typically most times it will take a couple treatments for it to completely get better, and I know it was just a couple days ago, so you're still in the very early stages of it.
Mm-hmm.
So it may take a couple treatments, but it should definitely help you out in the long run. So now that we've got that cleared up, we can go ahead and get into it. Do you have any questions for me?
No.
Okay, so before we get into it, I do need to go over some parameters that we'll be using. For a disc herniation, the parameters for traction are intermittent pelvic traction at a 3-to-1 ratio, 60 seconds on, 20 seconds off for 8 minutes at a straight line of pull with the hips flexed to 70 degrees. We're done.
I don't know what that means.
That's okay.